All right, so in this video, we're gonna review the hip rotation. And this movement is generally a little bit challenging for people because we rarely spend time out here, especially just lifting our leg up like this. So a lot of the muscles that should be, functioning the way we want are not. And we need to start reinvigorating that tissue and really start bringing in movement where there was no movement before. So we're gonna walk through the different parts of the movement. I'm gonna demonstrate first, and then we're going to get into the little details of what this looks like, okay? For this one, you're gonna either need two broomsticks or two sticks, or if you have two chairs, you can hold on to two chairs, or you can use the wall and do the movement. Whatever you have available is totally fine. The important thing is that you feel supported and that you're not balancing, okay? So you can use different things to make that happen. You wanna make sure that you're not just standing here without support and doing it. It's gonna be a lot harder, and it's gonna actually take away from the learning that we're trying to do, okay? So the movement is, we're gonna start with our legs about hip width apart. Don't be too wide. We want our heels stacked underneath our hips. And you're gonna start by bending your knee, and then you're gonna bring your knee up as high as you can towards your chest. You're gonna open up to the side. You're gonna twist your leg and kick back, and then you're gonna bring your knee towards your other knee and try to close that angle. And then you're gonna reverse, open up, twist, lift, and back to where you started. Okay, so we'll do it from the side here. Bend the leg, lift the knee, open up, twist and kick back, bring your knee together, and then reverse. Okay, so a few important things to notice here, that we really lack a lot of stability in this area of our body. You might have already noticed that by doing the previous module. So a really common problem that we run into here is that when we lift, we round. When we lift our knee, we round forward. And when we bring our leg back, we don't actually just move our leg, we kind of do this arching motion. So we'll lift, a lot of people will lift, come out to the side, and they'll do this. Right? So it's really, really important to notice what you're doing. So it's really important to try to keep the motion at your hip and not let it diffuse into your spine. If you do notice that this is happening, increase the breathing and bracing technique, increase how much tension you're using, and really think about just your hip and see how much can your hip move rather than thinking how wide can I swing my leg. Because a lot of people will think that they need to swing their leg really, really wide, and it's not, unless you have freakish range of motion, it's not as big as you think. So take the time to observe yourself and see what's compensating. And you kind of want to think that if you are twisting open, if I'm opening my leg up like this and I'm twisting, I want to think about two things. One, you can think about that diagonal muscles that we were talking about when we reviewed the abdominal bracing, this kind of like diagonal motion. But if I'm twisting this way, you kind of want to think of pushing this side of your pelvis forward, and you want to think about squeezing any rotational muscles in your body that are going to help kind of re-establish that square pelvis, okay? The other thing you want to think about is this other leg, that if you're really pivoting, I'll do it from this side. If I lift up and I open and I twist like this, then I'm really not controlling this hip. So we want to squeeze everything we can, and we really want to drive energy into the ground as much as we can, squeeze our leg, tighten our muscles in our leg, push the floor away. And when we open up, we're gonna actually resist the urge of doing this. And we're kind of gonna squeeze everything in order to allow that hip to just rotate in its socket. Okay? So those are the few things to notice. It does take time, so be patient and be aware of your breathing and bracing, especially in this one. So another thing to consider is this common compensation of leaning, and we really want to try to keep the weight of our body on our heels.